Gauteng Premier David Makhura is inspecting potential COVID-19 hotspots to ensure safety compliance. Together with Health MEC Bandile Masuku, he is visiting shops in Soshanguve Mall, Pretoria, to ensure social distancing and the mandatory use of cloth face masks. The provincial government is also checking whether retailers are complying with pricing regulations and food security standards. The health department says infections are expected to rise where retailers and shoppers fail to obey lockdown regulations.
Our emerging hotspots, township hotspots on COVID, and we have identified the areas where we have to target those areas to ensure compliance. Those areas where people come together, the shopping mall, like this place, lots of people come here. We want to make sure that every shop, every business that's open here in accordance with level 4 is compliant. Every business that's here must be compliant, including making sure that the people who are coming into the shops to buy are wearing masks. But there's also social distancing in the businesses, in the shops. There's sanitization in the shops. But we're also checking general compliance, because there are some of the businesses that are not supposed to be open during level 4. We are also checking that indeed the businesses that are open are those that are supposed to be open. And lastly, we are also concerned that there is many areas where we find that people are selling expired food. This contributes to the disease burden. It causes problems for our communities. And then the pricing, overpricing. So I've got the compliance units from the different departments in our province to just make sure that the normal way in which our businesses should run.
Makhura also added that the provincial government is working on a comprehensive strategy to curb the spread of the virus. The province is the second worst affected after the Western Cape, with over 2,000 infections and 22 deaths.
Ivory Park is another emerging hotspot of COVID. I need to explain that the hotspots are changing. In the first 2 months of COVID outbreak, the hotspots were principally in the certain areas in Gauteng, in the suburbs. Those areas we see lots of recoveries now. We see in many of those areas the active cases are going down. But we also see the shifts in the hotspots. So we see new hotspots are emerging. And when they are coming, particularly in the townships, it's a source of great concern for us. So our testing teams outside, as we are doing the work we are doing, we have our teams that are screening and testing outside as well, to just make sure that by the time we finish here today, we have tested as many people in Soshanguve as possible. Our transport team is focusing on the taxi ranks here in Soshanguve to make sure that the taxi ranks themselves, the public transport nodes, are complying. The same regulations. The taxis cannot have more than 70%. Everybody coming into the taxi must be wearing a mask, and the taxis are sanitized themselves, those public transport systems. So you can see we have a comprehensive approach. We are looking at all. So today we are targeting hotspots, but over the next few weeks we are going to be going into the townships across the province. We want to be ahead of the infection outbreak in that kind of way. We want to be able to ensure that we don't come here when it is too late. So that's what we are doing. When we start to see fewer cases in an area, before it becomes a big cluster outbreak, we are already there. We have isolated people. We have taken people out of the community who have tested positive, or contacts that need observation over 14 days. So that's what we are doing.